Yeah, so we actually just had a paper come out in Blood Advances looking at older patients. So we used the cutoff of 65 just because we had more patients that were 65 and above. But even for patients who are above 70, as we get older, we have more geriatric syndromes and we end up on more medications. So things like polypharmacy that can really affect our quality of life. And sometimes the treatments we use can worsen that quality of life in myeloma patients. And because the average age for myeloma diagnosis is 69 for Caucasians, 66 for African Americans, and 65 for Hispanic patients, it really matters what we're doing with older patients and what the rest of their disease and body is like. And what we were able to show is that even patients with, polypharmacy, where it's greater than 5 medications they're on, or super polypharmacy, like extra mega polypharmacy, where they're greater than 10 medications, having ECOG performance status of 2 or 3, again, mostly from their myeloma, but even potentially from other diseases that they might have, we were able to show that these patients do really well with CAR T, that it's safe, feasible, and they still get that benefit of progression-free survival without any further therapy. So when we talk about quality of life, our patients who are, actually have a lot more other disease burden, like neuropathy, or maybe they have, a history of some heart failure or some renal failure, and they're on these other medications, being able to come off the myeloma therapies actually helps them feel better. So I have grandmas and grandpas that are excited that they get to play with their grandkids and not have to worry about, getting sick all the time, especially 6 months after CAR T, where their immune system is much better. They're not on active treatment that's knocking down their immune system. They're able to travel, not because they're not having to come back and forth all the time. So again, some of our older patients actually, that quality of life is even better. Because their comorbidities really do dictate sometimes how much treatment we can give them. So if it's a one and done, they're not on any treatment anymore.